Are you thinking about getting a Standard Poodle puppy and wondering about the genetic testing? I'll give you a brief background on genetic testing for dogs and go over the recommendations for Standard Poodles. All dog breeds have specific medical problems that we now know have genetic links. With responsible breeding, we can greatly minimize these problems. This is a really cool development. It started less than 20 years ago, and it's revolutionized how breeders make decisions about breeding. Who makes these testing recommendations? Well, there are three primary groups that make the national genetic testing recommendations for dogs. The first one are the dog breeds themselves. Each dog breed has a national organization, like the Poodle Club of America, the Border Collie Society of America, the French Bulldog Club of America, etc. You can go to these websites directly, and you can find the current testing recommendations for each breed. The second is the OFA, which stands for Orthopedic Foundation for Animals. This is a large nonprofit database of canine health issues and tracking for breeds and breeders. The third is the AKC, the American Kennel Club. They also have some basic information on their website about specific breed health concerns. For Standard Poodles, all of these organizations recommend the same testing. The first two recommendations are actually considered requirements. First requirement is a hip x-ray done after age 2 to check for genetic hip dysplasia. The second is an eye exam done by a dog ophthalmologist to check for genetic forms of blindness. You're also required to do one of the following elective tests: autoimmune thyroiditis, sebaceous adenitis, a basic cardiac exam, or an advanced cardiac exam, which is an echocardiogram. Most Standard Poodle breeders will do all of these tests and will have their results on their websites. In addition to the ones that I just discussed, there are also other optional tests that can be done to check for things like von Willebrand's, neonatal encephalopathy, progressive retinal atrophy, degenerative myelopathy, multiple drug resistance, etc. If both the mother and the father are not carriers of these conditions, then the likelihood they will have puppies with them is low. But keep in mind that even with completely normal genetic testing, there are still many other diseases your dog can develop that we cannot predict ahead of time, like diabetes, various infections, heart problems, cancers, etc. The pre-breeding genetic testing does not guarantee a perfect dog, but it does reduce the likelihood of more serious genetic problems. Genetic testing is expensive. It involves x-rays, specialist eye exams, blood draws, skin biopsies, cheek swabs, cardiac echocardiograms. It's often over $2,000 to get all the testing done before breeding a dog. However, these new advances in testing and breeding have made every dog breed healthier. If you're considering a puppy, check out the links below.